Ronell Nolan, President CEO, Health Agents for America, coming to you live this Monday. As promised, I have some good news to share. It's not always good news that we have going on in our industry, but this is good news. First, I promised you that when we met with Congressman Buddy Carter from Georgia, he was going to give us some contacts for the state exchange. He has done that. His chief of staff sent me an email on Friday, and I will be reaching out today. Secondly, the biggest thing is my meeting last week with CMS Medicare. As I've repeatedly said, I have been trying for at least 4 years plus to get a liaison on the CMS Medicare side as we do on the CMS ACA side. We work very closely with Dean Mose. It's an amazing relationship, but we have none on the Medicare side. When regulations are released, when things are done, when we have questions, we have had no one to go to. I have been asking CMS, those on Capitol Hill, anyone that would listen, and every name I got was a dead end. They refused to answer. So right before the election, the presidential election, I again asked Senator Bill Cassidy, can you please give me a name, give me a contact that we have that we can work with? And he said, Ronell, that seems like such a simple issue. And I said, you would think that. But as promised, he gave me a name, the Deputy Secretary for Medicare. Now, through his relationship and his goodwill and his promises, we got that meeting set up. It was with two of the top brass for CMS Medicare. They totally understood our issue. They knew what was going on. I asked for an advisory board like we do on the ACA side so we can share information. I asked for help on the commission issue, why they allowed insurance companies to stop paying commissions after they approved the rates. I asked for several things. I didn't ask for a lot of things because I wanted this to be the initial meeting, the first meeting. I will say that they were very impressed at the fact that I loved Peter Nelson and that we had a relationship with Peter Nelson. They loved the fact that I gave Dr. Oz a big hug, and they talked about how great he was to work with and how excited they were for what he was going to do for this industry. And then finally, they worked really closely with Senator Bill Cassidy, which is a huge help for us because that is our friend, that is our relationship, and with us having the same person in the middle to help is huge. But everything that was said in that meeting was positive. I'll be honest, I almost cried when I got finished because it was such a relief to have someone to listen. I talked about speaking events. They were very excited about the possibility about speaking at the Medicarians. While it is a little too late to ask for a HAFA summit, I did put in a request for that. That's not going to happen, but maybe next year. So we put a bug in their ear for next year. You never know. But everything that was said in that meeting was positive about the good agents and brokers. They understood, they wanted to help, they wanted to be involved. They were going to bring everything that I said back to their leaders so they could figure out what the next steps were going to be. So immediately I sent a thank you letter, of course, immediately. And I will be following up on what are the next steps. And I talked about eventually having a face-to-face like we did on the ACA side, where we bring in folks like Dr. Oz to talk to Medicare agents, that Medicare agents are important, that we're professionals, that we're the ones that help seniors make hard decisions. I also talked about the fact that my dream would be to get rid of the stupid Medicare commercials where people think that Joe Namath is going to answer the phone, that seniors that are just lonely that want to talk to someone ends up changing their plans just because they saw a commercial. That's totally irresponsible. So while they kind of giggled about that, they did agree. Now, I want to say that I did get some emails from some folks about a bill that was filed going to House Ways and Means, and I'm not remembering the number, but it was about all folks would be automatically enrolled in Medicare Advantage. From what I understand, the research that I've done, it doesn't have any support, but I have written a white paper and we are faxing that and delivering it to the members of House Ways and Means. So while we think that it will not go anywhere, that's not a reason not to act. So this Monday morning news is dedicated to our Medicare agents. We've got your back. We hear you. We understand you. We know what you need. We're not going to give up. We continue to listen, and you continue to tell me what's happening. If there's something you need to talk about personally, I'm going to suggest that you email Daryl at hafamerica.org, and he can send you a calendar link to get on my calendar. That's the easiest way for me to be able to respond. I am flying to DC at the end of the week, and I plan on meetings with some staffers on some of the issues we have with the one big beautiful bill, and how we go forward, and if we need any technical amendments to help the consumers that we represent. But sending you so much love. I am blessed and honored to represent the HAFA Bulldogs. Can't wait to see you at the Agent Summit. Until then, have a great day.